Are you tired of being held hostage by relentless headaches? Do you find yourself yearning for answers, for that one key that could unlock the door to a life free from pain? Well, you're not alone. In this compelling video, we're about to embark on a journey of discovery together. What are the triggers that set the stage for these debilitating episodes? Can preventative measures truly pave the path to relief? And most importantly, how can you regain control over your life and bid farewell to the agony? The answers to these burning questions await you, right here, right now. All you need to do is stay tuned until the very end. Join us as we unravel the mysteries and unveil the strategies that could transform your story of pain into a tale of triumph. Hey there, fellow viewers. Have you ever experienced a pounding headache that seems to engulf one side of your head? Well, today, I have an intriguing and informative story to share with you. It's the tale of Jassi, a hardworking personal assistant in a private firm who suffered from debilitating headaches. But don't worry, there's a light at the end of the tunnel. Jassi, a vibrant young woman with a promising career. However, there was something that constantly hindered her ability to shine. One side of her head would throb, leaving her feeling sick and unable to concentrate on her work. It was time for Jassi to find answers, and that's where I come into the picture. The ordeal intensified when these debilitating episodes began to coincide with the onset of her menstrual cycle. Like clockwork, the impending arrival of her periods seemed to trigger these agonizing headaches, amplifying her discomfort and casting a shadow over her otherwise vibrant spirit. Jassi's quest for answers led her to a decision that would potentially alter the course of her struggle. With unwavering determination, she sought the expertise of a neurologist, hoping to find solace from the relentless grip of her headaches and the toll they were taking on her well-being. As the seasoned neurologist, I embarked on a comprehensive assessment to unravel the enigma that plagued Jassi's life. Our journey began with a meticulous exploration of her symptoms, the one-sided throbbing pain, the nausea that accompanied it, and the profound impact it had on her daily functioning. To cast a clearer light on the situation, a series of routine tests were meticulously organized. Jassi underwent a battery of examinations, including neurological assessments and blood work. A CT scan was conducted to ensure a comprehensive understanding of her cranial landscape, ruling out any potential underlying concerns. As the pieces of the puzzle began to come together, a definitive diagnosis emerged: Jassi was battling migraines. The alignment of her symptoms with the premenstrual period, commonly known as menstrual migraines, underscored the precision of our discovery. The conclusive diagnosis provided Jassi not just with an understanding of her condition but also with the empowerment to navigate her journey to relief. Jassi eagerly sought a deeper understanding of her migraine condition from her doctor. A migraine is a common neurological disease that causes a variety of symptoms, most notably a throbbing, pulsing headache on one side of your head. Your migraine will likely get worse with physical activity, lights, sounds or smells. It may last at least 4 hours or even days. Research shows that it's the 6th most disabling disease in the world. What are the types of headaches? What type of headache is a migraine? There are over 150 types of headaches, divided into 2 categories: primary headaches and secondary headaches. A migraine is a primary headache, meaning that it isn't caused by a different medical condition. A secondary headache is a symptom of another health issue. What is an aura? An aura is a group of sensory, motor, and speech symptoms that usually act like warning signals that a migraine headache is about to begin. Commonly misinterpreted as a seizure or stroke, it typically happens before the headache pain, but can sometimes appear during or even after. An aura can last from 10 to 60 minutes. About 15% to 20% of people who experience migraines have auras. Aura symptoms are reversible, meaning that they can be stopped. An aura produces symptoms that may include seeing bright flashing dots, sparkles, or lights, blind spots in your vision, numb or tingling skin, speech changes, ringing in your ears, tinnitus, temporary vision loss, seeing wavy or jagged lines. Changes in smell or taste. A funny feeling. What are the types of migraines? There are several types of migraines, and the same type may go by different names. Migraine with aura, complicated migraine. Around 15% to 20% of people with migraine headaches experience an aura. Migraine without aura, common migraine. This type of migraine headache strikes without the warning an aura may give you. The symptoms are the same, but that phase doesn't happen. Migraine without head pain, silent migraine or acephalgic migraine, as this type is also known as, includes the aura symptom but not the headache that typically follows. Hemiplegic migraine, you'll have temporary paralysis, hemiplegia, or neurological or sensory changes on one side of your body. The onset of the headache may be associated with temporary numbness, extreme weakness on one side of your body, a tingling sensation, a loss of sensation and dizziness or vision changes. Sometimes it includes head pain and sometimes it doesn't. Retinal migraine or ocular migraine, you may notice temporary, partial or complete loss of vision in one of your eyes, along with a dull ache behind the eye that may spread to the rest of your head. That vision loss may last a minute, or as long as months. You should always report a retinal migraine to a healthcare provider because it could be a sign of a more serious issue. Chronic migraine. A chronic migraine is when a migraine occurs at least 15 days per month. The symptoms may change frequently, and so may the severity of the pain. Those who get chronic migraines might be using headache pain medications more than 10 to 15 days a month, and that, unfortunately, can lead to headaches that happen even more frequently. Migraine with brainstem aura. With this migraine, you'll have vertigo, slurred speech, double vision or loss of balance, which occur before the headache. The headache pain may affect the back of your head. These symptoms usually occur suddenly and can be associated with the inability to speak properly, ringing in the ears and vomiting. Status migrainosus. This is a rare and severe type of migraine that can last longer than 72 hours. What are the 4 stages or phases of a migraine? What's the timeline? The 4 stages in chronological order are the prodrome, aura, headache, and postdrome. About 30% of people experience symptoms before their headache starts. The phases are: prodrome, the first stage lasts a few hours, or it can last days. You may or may not experience it as it may not happen every time. Aura, the aura phase can last as long as 60 minutes or as little as 5. Most people don't experience an aura, and some have both the aura and the headache at the same time. Postdrome, the postdrome stage goes on for a day or 2. It's often called a migraine hangover, and 80% of those who have migraines experience it. It can take about 8 to 72 hours to go through the 4 stages. Headache, about 4 hours to 72 hours is how long the headache lasts. The word ache doesn't do the pain justice because sometimes it's mild, but usually, it's described as drilling, throbbing, or you may feel the sensation of an ice pick in your head. Typically it starts on one side of your head and then spreads to the other side. Who gets migraines? What are the risk factors? It's difficult to predict who may get a migraine and who may not, but there are risk factors that may make you more vulnerable. These risk factors include stress level. You may get migraines more often if you're high stress. Stress can trigger a migraine. Smoking, genetics. Up to 80% of people who get migraine headaches have a first-degree relative with the disease. Gender. Migraine headaches happen to women more than men, especially women between the ages of 15 and 55. It's likely more common in women because of the influence of hormones. How often do migraines happen? The frequency of a migraine could be once a year, once a week, or any amount of time in between. Having 2 to 4 migraine headaches per month is the most common. Are migraines hereditary? Migraines tend to run in families. As many as 4 out of 5 people with migraines have a family history. If one parent has a history of migraines, their child has a 50% chance of having them. If both parents have a history of migraines, the risk jumps to 75%. Again, up to 80% of people with migraines have a first-degree relative with the disease. Can children get migraines? Yes, but pediatric migraines are often shorter and there are more stomach symptoms. Who should I see about my migraine pain? Discuss your symptoms with your primary care provider first. They can diagnose migraine headaches and start treatment. You may require a referral to a neurologist. Do migraines cause permanent brain damage? If I have migraines, does that mean I'll get another disease? No. Migraines don't cause brain damage. What are the symptoms of migraines? The primary symptom of migraine is a headache. Pain is sometimes described as pounding or throbbing. It can begin as a dull ache that develops into pulsing pain that is mild, moderate, or severe. If left untreated, your headache pain will become moderate to severe. Pain can shift from one side of your head to the other, or it can affect the front of your head, the back of your head, or feel like it's affecting your whole head. Some people feel pain around their eye or temple, and sometimes in their face, sinuses, jaw, or neck. Other symptoms of migraine headaches include sensitivity to light, noise and odors, nausea and vomiting, upset stomach and abdominal pain, loss of appetite, feeling very warm, sweating or cold, pale skin color, pallor, feeling tired, dizziness and blurred vision, tender scalp. Most migraines last about 4 hours, although severe ones can last much longer. Each phase of the migraine attack can come with different symptoms: prodrome symptoms, problems concentrating, irritability and depression, difficulty speaking and reading, difficulty sleeping, yawning, nausea, fatigue, sensitivity to light and sound, food cravings, increased urination, muscle stiffness, aura symptoms, numbness and tingling, visual disturbances. You might be seeing the world as if through a kaleidoscope, have blurry spots or see sparkles or lines. Temporary loss of sight. Weakness on one side of the body. Speech changes. Headache symptoms, neck pain, stiffness. Depression, giddiness and/or anxiety. Sensitivity to light, smell and sound. Nasal congestion. Insomnia. Nausea and vomiting. Postdrome symptoms, fatigue, lack of comprehension, euphoric mood, inability to concentrate.